It is my pleasure to welcome Dr. Lee, an interventional cardiologist and high volume operator at Samsung Medical Center in South Korea. He's additionally the first author of the Renovate Complex PCI trial. Today, we'll be discussing an important JACC interventions manuscript reporting the outcomes of intravascular guided PCI versus coronary artery bypass grafting, or CABG, for left main or three vessel disease. Dr. Lee, thank you so much for taking the time to join us and share your expertise.
Thank you very much for your nice introduction. I'm very honored to do this interview, and I'm more than happy to introduce our recent work published in JACC Intervention simultaneously during the ESC conference. So, my study, actually, the intravascular imaging guided PCI versus coronary artery bypass grafting for left main or triple vessel disease. This was the individual patient level analysis of the Renovate Complex PCI trial and our institutional registry of PCI and bypass surgery. We thought this study might be helpful for the readers because previously, there were multiple trials which compared PCI versus bypass surgery, and those trials consistently showed that PCI was inferior than bypass surgery for patients with left main or triple vessel disease. However, there have been another trials like pre-combat or Excel trial that contradict those findings. So for the patient with left main disease, those trials showed comparable risk of clinical event between PCI and bypass surgery. And over the past few decades, there were remarkable advances in PCI, especially the intravascular imaging guided procedural optimization. It shows better clinical outcome than angiography guided PCI. For example, including the Renovate Complex PCI trial and the Occupy October, IBUS ACS, and Illumine 4 studies, those trials consistently demonstrated that image-guided PCI is much better than angiography-guided PCI, especially for the patient with complex coronary artery lesion. So based on that, we thought it is very clinically relevant issue to compare image-guided PCI versus bypass surgery in patients with left main or triple vessel disease. And there has been no relevant trial for this issue. So we did our analysis using the Renovate Complex PCI trial and the institutional registry of bypass surgery.
Yeah, I completely agree, and I think that's a very nice summary of the background. And as you mentioned, these trials are somewhat older now. PCI technique has changed and evolved over the last years. I'm kind of excited to hear about the results of your analysis, if you don't mind sharing with us.
Yeah, thank you. So as I explained it before, so the Renovate Complex PCI trial, the patient number is 1,639 patients. And in addition to this trial, we added more patients from our institutional registry. So after the matching the inclusion and exclusion criteria, a total 4,611 patients with the left main or triple vessel disease treated by second generation drug-eluting stent were included in this analysis. And from the institutional CABG registry, we selected the patient with the left main or triple vessel disease. So a total of the 6,962 patients with left main or triple vessel disease were analyzed in here. So among those, about 7,000 patients, about 10,000 patients were treated by angiography-guided PCI, and 848 patients were treated by intravascular imaging-guided PCI, and the remaining patients, in about 5,000 patients, were treated by bypass surgery. And the primary outcome of our analysis was the all-cause mortality non-fatal myocardial infarction or stroke at 3 years from the index procedure or index surgery. So among the total population, when we compare total PCI population versus bypass surgery, the PCI had a higher risk of primary outcome than bypass surgery, and it was also true in the propensity score matched analysis. However, when we separate the PCI population into the angiography-guided PCI and the intravascular imaging-guided PCI, we could see the clear trend of the risk of primary outcome was the highest in the angiography-guided PCI. However, the cumulative incidence of primary outcome was similar between intravascular imaging-guided PCI and the bypass surgery. So at 3 years, the incidence of primary outcome was 17% in angio-PCI, and it was 10.8% after bypass surgery, and it was 8.7% after image-guided PCI. And when we further analyze the image-guided PCI versus bypass surgery using propensity score matched analysis, the 3-year incidence of primary outcome was 9.5% after image-guided PCI, and it was 9.4% after bypass surgery. So in overall, image-guided PCI had a comparable risk of primary outcome compared to the bypass surgery. However, in more detail, all-cause mortality was lower in the image-guided PCI than bypass surgery. However, the image-guided PCI were followed by higher risk of non-fatal MI and the lipid revascularization. The risk of stroke was comparable between the two groups. So in conclusion, we observed the comparable risk of a composite of all-cause mortality, non-fatal myocardial infarction, or stroke between image-guided PCI and the bypass surgery in patients with left main or triple vessel disease. So the next step would be we need the randomized control trial to confirm this our findings in the future.
Thank you. This is very nice, a very nice summary, and I completely agree. I think the next step, especially with it's kind of this hypothesis generating, analysis, I think it's definitely to move forward with a trial to see if we can prove this prospectively. Thank you so much, Dr. Lee, for your time, for your overview of the results, and I'm very excited to invite everyone to go over the full manuscript published in this issue of JACC Interventions. Thank you so much again.
Thank you so much, and have a nice remaining day.